Hi, I'm Ellen Bradshaw, your compliance officer for today. I'm here to talk to you about the moral rights to healthcare. The Vermont Ethics Network says healthcare for all is arguably a moral right. We base our hospital on 4 primary concepts. The first is the principles of healthcare ethics: autonomy, beneficence, non-maleficence, and justice. We value offering the highest quality of affordable health care, and we strive on encouraging our patients to live healthier lifestyle. Our vision is that we want you to feel welcome, and we want to be the healthcare organization that you trust with your life. Our mission is to focus on enterprising objectives to bring the latest innovative technology to our Commonwealth. Our first topic is going to be patient safety. We will discuss the Patient Safety and Quality Improvement Act of 2005. It was set up to manage the privacy and legal protection for those who voluntarily reported safety violations and preserve the patient's rights. The point was to encourage healthcare professionals to provide superior safety and quality of care. The Healthcare Quality Improvement Act was set up to improve the quality of medical care and to put a stop to overwhelming number of malpractice suits. The Medicare and Medicaid Patient and Program Protection Act of 1987 was set up solely to protect patients from unsuitable healthcare practitioners. And the National Patient Safety Foundation is a nonprofit organization dedicated to creating a world where patients and those who care for them are free from harm. Our next topic is informed consent. The essential elements or requirements are an adequate disclosure of information. Make sure the patient has the capacity to legally decide. The patient must comprehend the information, and the patient is doing the procedure, test, or trial of their own accord, and consent of the patient is a signature on the informed consent form. An X or voluntary agreement, verbal or a nod of the head, is acceptable. The patient is to make sure that they ask questions so that they are entirely comfortable with consenting to the procedure, and make sure they get copies of anything that they sign. Our next topic is genetic discrimination. Genetic Information Non-Discrimination Act of 2008, better known as GINA. It pertains to a person's genetic test and that of the individual's family members, plus any genetically transmitted information about a manifestation of a disease or disorder. GINA is an extension of HIPAA because it has to do with an individual's personal health information. Title I of GINA prohibits discrimination of healthy individuals applying for health insurance plans, including any adjustment to premiums because of their genetic configuration. And Title II of GINA prohibits discrimination of healthy individuals being denied hiring, promotions, or getting fired due to their genetics. Next, we'll talk about patients' rights. Patients' Bill of Rights is right to considerate and respectful care, the right to current medical information, right to decide treatment, right to advance directive, right to privacy, right to confidentiality of PHI, right to refuse participation in research testing, right to continuity of care after hospitalization was needed, if needed, right to be informed of all hospital policies and procedures. Next, we have the Patient Protection, Accountability, and Affordability Act of 2010, better known as Obamacare. It was enacted to allow the American people to choose their health care plans. And we will last talk about the right to die. There are many reasons people choose to end their lives. One choice is euthanasia, is considered passive when the death occurs because all life-supporting treatments and equipment are stopped. Active euthanasia is when lethal substances are administered to the patient so that they will die. Physician-assisted suicide is when a terminally ill patient is given either a lethal injection of a substance or they are provided with a lethal substance in liquid or pill form to be swallowed to induce death.